I'm going to introduce you guys to my top 4 pick of Jamaican herbs that are traditionally used by Jamaicans to treat the common cold, the flu, and other respiratory infections. Keep watching. Welcome to another episode of Earth's Medicine, the channel that introduces you to the healing wonders of Mother Earth with a Jamaican flavor. So it's coming on to that time of the year again when the season changes and we're more susceptible to picking up the common cold, the flu, and other respiratory infections. So I'm going to introduce you to my top 4 pick of Jamaican herbs that are traditionally used by Jamaicans to treat the common cold, the flu, and other respiratory infections. And if you're living in Jamaica or the Caribbean, then it's quite likely that these herbs may just be growing in your backyard. But what good are these herbs to you if you're not able to identify them and you're not aware of their medicinal effects? So that's why I'm here today, guys, because I'm going to help you to identify them, by giving you a description, letting you know the scientific name and the common names and where they can be found growing, and also showing you how they are used in Jamaica to treat these conditions. So without further ado, let's jump right into the video. Okay guys, I'm going to start with number 4 and take it right down to number 1. The first plant that I would like to introduce to you is called Jack in the Bush, pronounced Jack on the Bush or Jack in the Bush by Jamaicans. The preferred scientific name for Jack in the Bush is Cromonella odorata, and it has many common names in different languages depending on the region. For example, there is Siam weed, Christmas bush, baby tea, and bitter bush, and this list goes on and on. Jack in the Bush is native to Central and South America, but it can be found growing in tropical and subtropical areas like Jamaica and the rest of the Caribbean, some parts of the United States, Africa, Asia, and Oceania. The plant is an upright, fast-growing perennial shrub that forms dense bushes and can grow up to 3 meters tall. Its stems are slender with oppositely arranged leaves that are diamond-shaped with jagged edges and a pointed tip. And it has 3 prominent veins near the base of its leaves, which resemble a pitchfork. And young leaves of the plant are purplish at the base, and the plant produces white flowers. The plant grows best in sunny, open areas such as along roadsides, in abandoned fields, pastures, and disturbed forests, but tolerates semi-shade conditions as well. In Jamaica, it grows wildly, organically, and abundantly in backyards
and other green spaces. The seeds are airborne and are mainly distributed by wind and by attaching to machinery, people, and animals. Traditionally, various cultures around the world have used Jack in the bush as a part of their folklore medicine to reduce fever and to treat the cold, the flu, as well as coughs. In Jamaica, traditionally, it is mainly used to treat sinusitis, fever, the cold, the flu, asthma, as well as bronchitis. This is usually done by harvesting fresh leaves from the plant or by using the dried leaves to make quote-unquote bush tea. Some persons harvest the shoot of the plant and combine it with other herbs and coconut milk to treat bronchitis in children as well. Persons in Jamaica also use the plant to treat coughs and nasal congestion, and they do this by crushing fresh leaves from the plant and inhaling them. Current studies done on Jack in the bush shows that this plant does have properties enabling it to prevent or reduce fever, antioxidant properties, and many other medicinal properties in an appreciable scale. Jack in the bush should not be taken by pregnant women as it may cause a miscarriage, low birth rate, or congenital abnormalities. Coming in at number 3, my next top pick Jamaican medicinal plant is called guinea hen weed. This is a medicinal plant that has long been used traditionally across various cultures as a part of folklore medicine to boost immunity and treat a variety of health issues, including certain cancers. Guinea hen weed is scientifically known as Petiveria alliacia. However, it has several common names depending on the region in which it is found. For example, in the Dominican Republic, Puerto Rico, and Brazil, it is called anamu. In Guatemala, it is known as apacin, and in Peru, Latin America, Trinidad, and Jamaica, the common names are mucura, Guinea, mapurete, and guinea hen weed, respectively. And this list goes on and on. Guinea hen weed can be found growing in tropical and subtropical climates, for example, in Florida and Texas in the US, Central and South America, Jamaica and the rest of the Caribbean, Mexico, as well as the sub-Saharan part of Africa. Guinea hen weed is a perennial, fast-growing, herbaceous shrub that can grow up to 1 meter tall. It has a deep root system and small white flowers, and the roots and leaves have a very pungent smell, which is similar to that of garlic. Guinea hen weed prefers a rich, moist soil and a position in partial shade. It is usually found in disturbed areas, edges of humid forests, along roadsides, riverbanks, pastures, and gardens. In Jamaica, it grows wildly, organically, and abundantly in backyards and other green spaces. The plant also grows very easily, and the seeds are usually dispersed by being blown in the wind or by attaching to animal fur or human hair and clothing. Traditional uses of Guinea hen weed date as far back as the Mayan era, where it was common practice to use the plant to boost the immune system and to treat respiratory infections, including the symptoms associated with the cold and influenza. Traditionally, other cultures around the world have also used Guinea hen weed as a part of their folklore medicine to treat asthma, whooping cough, pneumonia, bronchitis, as well as the cold and the flu. Guinea hen weed has also been used to treat hoarseness as well, and internal application is used as treatment for the latter. Persons have also used the plant to treat fever using external application, and liquid from the leaves has also been used as nose drops to treat sinusitis. In Jamaica, the leaves of the plant are traditionally used as a part of folklore medicine to make quote-unquote bush tea. And the root of the plant, which is said to be more potent, is used to make a decoction, which are both taken internally to treat the common cold, the flu, and other respiratory issues, as well as fever. And usually by drinking the tea or decoction at the start of a cold or flu, the lifespan of same is usually shortened. The root of the plant is also chewed by some persons, and the juice swallowed or the root is inhaled to treat sinusitis as well. Over the last few years, intensive research has been done on the plant, and many biologically active compounds have been discovered in guinea hen weed, and there has been published research on the latter that validates many of the traditional uses of the plant. Pregnant women and women trying to conceive should avoid using guinea hen weed for women who are breastfeeding. Persons on blood thinners should avoid using this plant as it contains a blood thinning property that could interact with blood thinning medications and other medications for heart conditions. Low blood sugar is also a side effect of guinea hen weed. Coming in at number 2 is the leaf of life plant, which is also a very powerful medicinal plant that is used across various cultures in traditional folklore medicine to treat a wide range of health issues, including respiratory infections. Leaf of life is scientifically known as Bryophyllum pinnatum, and it has numerous common names depending on the region in which it is found. For example, there is miracle plant, love plant, air plant, love bush, live forever, as well as life plant, and the list goes on and on. Leaf of life is native to Madagascar, but it also grows in Australia, New Zealand, Central and South America, Asia, the Caribbean, and some parts of the United States, as well as the southern parts of Africa. Leaf of life is a fast-growing, long-lived plant that can grow up to 2 meters in height. The leaves are succulent and wide, thick and fleshy, and the edges are also jagged. Leaf of life also produces a greenish yellow to pinkish red flower, which is usually found over the stem in clusters at the very top of the plant. The leaf of life plant does very well in ordinary, enriched, as well as mildly alkaline soil. You can find it growing in gardens, along roadsides, railway lines, open woodlands, coastal environs, waste areas, forests, and forest margins. In Jamaica, it grows wildly, organically, and abundantly in backyards and other green spaces. The plant also prefers a semi-shade environment, and as mentioned before, it grows very, very easily and tolerates almost any conditions. And it will propagate itself from plantlets present on the leaf margin, which eventually grows into a new plant. In Jamaica, leaf of life is quite popular in folklore medicine and is chiefly used to treat the common cold and the flu, coughs, asthma, shortness of breath, as well as bronchitis. This is usually done by using the leaves of the plant to make tea, blending it in juices, or it is eaten raw. Pharmacological studies done on the plant also reported several biological activities, some of which could authenticate the plant's traditional uses, including antioxidant properties. Persons using aspirin medication should avoid using leaf of life plant as it could interact or reduce the efficacy of aspirin. And my number one pick of Jamaican medicinal plant is called vervain, also pronounced vervain by Jamaicans. This plant is literally a panacea for many, if not all, respiratory issues, and it should be in every home for immediate use when needed. The scientific name for vervain is Stachytarfeto jamaicensis, and it has several common names, such as Jamaica vervain, Brazilian tea, verbena, blue porterweed, as well as snakeweed. Vervain was already known in Asia from as far back as the 18th century, but it is generally agreed to be native to tropical America. The plant can also be found growing in the subtropical forests of Africa as well as Oceania. Vervine is a perennial, weedy, herbaceous plant that can grow up to 4 feet tall. It has a slightly square stem and the leaves are jagged with a shiny top. The plant produces purple flowers that are arranged on long, relatively thick spikes at the top of its branches, which have 5 petals. These petals are usually about half of a centimeter in length. There is another variety of vervain found in Jamaica that bears some resemblance. However, the leaves are thicker and the ridges that run along its veins are more pronounced. The flowers are white and the stems are woody as well. Vervine prefers part shade, part sun, and the plant tends to grow in forests and forests margins, along roadsides, disturbed sites, waste areas, waterways, floodplains, coastal environs, gardens, plantation crops, and pastures in tropical and subtropical regions. It can also be grown in pots as well. In Jamaica, you can find it growing wildly, organically, and abundantly in forests, along roadsides, and in other green spaces. And the seeds are mostly spread by becoming attached to animals, clothing, vehicles, and machinery. Traditionally, vervine is widely used in folklore medicine across various cultures to treat a host of health issues, including respiratory infections. In Jamaica, one of the primary uses of this plant is to treat respiratory infections such as the cold and flu, asthma, bronchitis, as well as coughs, sore throats, fever, shortness of breath, and to expel phlegm from the throat and chest. And treatment is usually administered by harvesting fresh leaves from the plant or by using the dried leaves to make quote-unquote bush tea, which is usually taken often until symptoms disappear. Vervine is not recommended for pregnant women. Individuals with low blood pressure should avoid using this plant because of its hypotensive effect. The purpose of this video is for enlightenment. Vervain should not be taken as a substitute for pharmaceutical medicine. If you are feeling ill or you have any health concerns, please speak to your doctor about same.